Hi Ritu. Hi Nandita. Hi Shreya. Hi Dr. Amla.
Hi, how are you?
Fine, Dr. Amla. Nice to see you again.
Same here.
uh, yeah, just left. We'll wait for 1 or 2 more minutes. Let the people join. More people join. Then we'll start. Till then, I'll start with your introduction. She is Dr. Amla, and she's a founding consultant of Heal with Food, chief consultant of Ayurveda Wellness Clinic, co-founder of Skin Love Studio, and she's a specialized in Ayurvedic cosmetology, aesthetic, dermatology, cosmetic formulation, and she is a big performer. I cannot explain in few words. So better we'll start with Dr. Amla to speak few things about herself first before going further.
Okay, thank you so much for this wonderful introduction. So actually, people might think that I'm starting off with so many things. It's just that, cosmetology is a very upcoming branch. And luckily, I was taken into cosmetology, Ayurvedic cosmetology 5 years back. And whatever experiences I had, it was very nice. We had tried out what is mentioned in our Ayurveda, how we can put in our daily lives. So it was very good. But now COVID lockdown actually has given a very boom in online education. And we have tried and tested so many things. We have come across so many people. And there we could explore new horizons in this field. So in that,
True.
actually could make out so many, have tried to incorporate Ayurveda in cosmetics because we know the trend is changing every now and then. And people are more aware, people are more aware of what goes on to their skin. So that makes it more prominent in this time. And it's the right time also. People are so upset with so many things happening in their life. And if we can make them feel a bit confident by looking beautiful, by feeling beautiful, that is one thing that we can
True.
always have.
Right, true, Dr. Amla. You are really true. And in fact, I think in the not in given trend, this being looking beautiful is since like 1,000 years back. Detail of Ayurveda cosmetology has already written in our Ayurveda text a long back. But the thing is, we were into like our generation was more into chemical this thing, but now I'm happy like from the last few years our new generation and we also are more try to bring more chemical free treatments, chemical free things to them. At least I'm more into it, and people like you around will also boost that confidence in others. Yes, we can do much better without chemicals, isn't it? Okay, so
Yeah, usually what happens, so I was reading an article, people actually considered skincare, what goes on a skin, as a skin food. Okay, so they're like, we are very much concerned what we eat. We take our ingredient list, we see, okay, is it really helpful for us? In the same way, people have actually started looking out at the ingredients of the cosmetics and whether they are
true.
actually good for you. And people started questioning also. So that actually made the whole new revolution in this world.
Right, true. And okay, so without going into this further here and there, we just directly go in Ayurveda. Like as per Ayurveda, what are the different skin type we actually have, and how the people know that what kind of skin they are having? So just a little bit knowledge to them.
Sure. See, usually we know when we ask what are the skin types, people know, they have to select a cosmetic whether their skin is dry, oily, or sensitive. So they might think this is a very general classification, but that is actually a scientific classification which has been mentioned in Ayurveda. So know that, Ayurveda basically has 3 prakritis. That is the Vata, Pitta, Kapha. So that is basically on the permutation and combination of the Pancha Mahabhutas. So not sounding very technical, I'll explain it to you simply. See, you can imagine around 5 to 6 people within your family. Okay, maybe the first line of circle of friends. Okay, so in that you can just see how many people. They're always talking. They're very lean, no matter whatever they do. They cannot sit idle in a place. They just keep moving here and there. Okay, and if you look into their face, they actually feel a bit more aged than their age. Okay, so all these things are typically Vata Prakriti people, and they have a predominance of Kasha and Vayu. So If you look at wind and space, it is something which is very light, always drying. Those quality goes to your skin and hair. So if a person is a Vata Prakriti, they will have a dry skin, dry hair, and the dry skin, there is less of moisturization. It will make you look, will feel older for your age. Okay. Then you have some type of people who are actually, very, very short tempered. Okay. You're a bit skeptical to go up to them and see, is it okay? We never know when they lose their temper. But they've got a very nice skin. And they are the people, once they get angry and all their faces becomes red very fast. So this category is the Pitta Prakriti people. So generally, normal skin belongs to the Pitta Prakriti. But if at all your Pitta is imbalanced, you get a sensitive skin. Next category is the people who are always lazy, who are very slow to start. And they are like, once they start, they fix it off. They take their own time. And they are the people, they say, even if we smell food, we put on weight. So that is Kapha Prakriti.
Right.
So they are always nourished. So their skin and hair will be highly. So this is the Ayurvedic classification based on Vata, Pitta, Kapha. You might have a combination skin type also. See, you have some people say, this is the T-zone of your face. Okay. So if you have a matte finish here and a oily finish here, or if you have an oily finish here or a matte finish here, it is a combination skin type. So based on that, you will have to keep assessing your skin and choose your cosmetics and your skincare routine.
Okay, so we will talk about this mixed type, because normally in my practice also and in your practice also, you must get the patient more of skin type and they're still worried. Okay, I cannot use oil base, I cannot use gel base, so what is our plan? So we'll talk about that. So now, this is, you talked about face. So we'll just, the same category, can you generalize Vata, Pitta, Kapha hair type?
Seriously, see, some people, they say, their hair is not strong. Even when you brush very fast, it will break off. It is very dry.
Right.
So that is usually related to the Vata or the dry skin people. They will always have a dull looking hair. It's not very strong. And you have a Pitta Prakriti people who actually have a normal hair, the growth is very nice and it is maintained properly. Kapha Prakriti people, because we know their nourishment quotient is always nice, they will have a lustrous, shiny hair, but always there will be more of excessive oil production, what we call sebum. So their hair will always be oily no matter how much you shampoo. Post 1 or 2 hours, their hair will be still oily, making their face oily. All the typical comes under the Kapha Prakriti. So this will be the classification of hair according to Vata, Pitta, Kapha in Ayurveda.
Okay, so again, though I know the answer, but still I want to ask this question to know our viewers that do your internal Prakriti influence your face, skin and hair? Always? It is always like that?
Yes. See, we will be having a Prakriti when we are conceived. It will remain throughout. But we will have a diurnal variation. I'll tell you, if you don't sleep yesterday, like a previous day night, the next day your morning your skin will be dull. It will be puffy. So what happens is there's a Vata Prakopa and you will have the dryness which makes your skin look very dull. But that is not a permanent effect. It's a temporary effect. You can see I've got very puffy.
I know, because you just, yes.
So it's a very typical example I can show now.
It's okay. Because I know that you like she just just bring up from the COVID and she's recovering from COVID. Still, she'll accept my invitation. Thanks for her.
So
okay,
I'll tell you, when we have some nice spicy foods, or what happens is we might have a constipation or an irregular bowel movement. So when our bowel movement is also not very clear, we can notice that the next day our face is dull. So whatever is happening inside your body is reflected on the skin. So they say a healthy skin is indicating a general health of your body.
True. Right. Okay, so now this is the thing, like I think the people now can generalize, they can make out what kind of skin they are having, or in case you want to know, you can always consult Dr. Amla or me to know more about your Prakriti. We surely will help you. Now the thing is, what is the general thing you will ask them, the Vata person, only Vata person, to follow as a daily regime for this skin type so that they can at least maintain their lustre?
See, what happens, as we know, any excessively dry skin is always related to vata. Okay, so what you have to do is you have to keep on moisturizing it. So ideally, you should have, see, people will think that having a cleansing, toning, moisturization, that the CTM of skincare is not compulsory,
Yes.
but actually it is. Okay, so it's just how you choose it. So here, the moisturization part, initially, if you have not started taking care of your skin till now, the first time you're going to buy it, you would have to buy a butter, because the butter will have more of an oil content, which will make your skin hydrated. But it is not to be continued for long, because once you start applying butter regularly, post 2-3 weeks, your skin starts becoming normal. So at that moment, you might have to switch on to a cream. Okay, so this is regarding the cosmetics. But otherwise, you have to make sure your face is washed regularly, not in hot water, because hot water takes off the natural oil of your body, making it still more drier. So just the normal tap water or cold water, you can wash your face regularly, and then you can always make sure you don't leave your skin without any moisturization. That is the compulsory note that Vata Prakriti or dry skin people have to keep for themselves.
Sure, sure. Very nice. So now we switch to Pitta Prakriti. So those who are Pitta Prakriti, just keep your ears open, right?
Yeah. So for Pitta Prakriti, if your Pitta is good, you will have a very clear skin. At the same time, you are very sensitive to certain things. So it can be an internal factor. See, most of the people who know there's urticaria, and COVID is now triggering the urticaria or the hives or the itching you have. And what happens is, it will be more aggravated in a Pitta Prakriti. When a Pitta Prakriti skin is aggravated, you can notice there will be redness, there will be, the temperature will be slightly more, that is inflammation, all that will be there. So always keep sure you have some cooling things like your aloe vera gel or a face mist. All these has to be kept handy, and you have to make sure you can use any of these whenever there's a sensitivity. Coming to the cosmetic, these are the people who are actually blessed to try out anything they want, be it a butter, gel, or a basic emulsion, that is a cream or lotion. So you have a wide variety to choose from. It's just that you have to see which is good for your skin. Ideally, you can have anything that is very mild and can be used for the long run. Maybe something with olive oil or cocoa butter. All these will be a good choice.
Good. Now, the Kapha Prakriti.
Yeah. See, dealing with kapha is actually very tricky, because, their face is oily. So any sort of oil that goes on the skin will actually make sure, it is increasing the oiliness. It's like, you add something, sugar into something sweet, it gets more sweeter, right? So oil is already there. You are applying any cosmetic with an oil, there will be an acne breakout. So it is very risky. So the only thing is, you have to give them gels. But the disadvantage of gel is, as soon as you apply it, it's absorbed in. You will have to keep on applying things. So the secret behind that is you have to fool your brain. Okay, there are some oils which, when we apply on the skin, actually resembles our natural oil. Okay, so what happens is the body cannot recognize, okay, there is something extra that is coming in. So they will be like, okay, it's what is normal, let it go. So such oils are your argan oil. Okay, wheat germ oil. So if you have a cream or a gel cream which has got these oils, it can be done for a Kapha Prakriti person. And if you feel there is excessive oiliness, you are free to wash your face with Triphala Kashaya. So Triphala is one very easily available Ayurvedic drug. It wipes off the excessive oil. Or if you don't have that, just washing your face with normal hot water, that is lukewarm water, also helps in controlling it. You have to.
We are waiting. We are waiting. Actually, some network issue from Dr. Amla's side. Yeah, I think some network issue was there.
It's raining
okay.
here.
So okay, no worries. See, so the very important tip she has given, that wheat germ oil and argan oil is very good for Kapha Prakriti. Those who says that they keep like their face is very oily, so still they can use oil. You should keep applying oil. Never, you should not think that because you are Kapha Prakriti, your skin is oily, you should not apply oil. First thing. Second thing, Dr. Amla, few of us, like being the Ayurvedic doctor also, some people has confusion. They keep always compare the acne with the Pitta Pitta Prakriti, not with the Kapha Prakriti. So can you please clarify this, the doctors who are listening here?
See, it's actually a combination. See, when there is an excessive sebum production, which is mostly associated with Kapha Prakriti skin type. Okay, so there it causes, the first step is done by the Kapha Prakriti. Then what happens? You have a normal bacteria microbiome on the skin, which will multiply in these acne. You know, fatty things is a food and nutrition for these bacteria. So they just keep on multiplying. That suppuration is due to the pitta. So when your acne suppurates, you have cystic acne, nodular acne, all that is due to the pitta involvement. But for some people, you know, you have blackheads and whiteheads. Mostly it is
Right.
due
I was
to
about
drying
to ask
skin.
you.
Yeah, because you know, if you touch the blackhead area, it is very rough. So that causes the
Right.
drying. So if you go for a cleanup also, they first give you a massage so that you know your skin becomes soft. They give you a steaming so that the pores open, and only then they take out the blackheads. So that wholly makes a difference, because see, the acne is due to a excessive oil secretion. But what it culminates, it's as you have different types of acne. Like blackheads is one type of acne only. You have the cystic and nodular. So what is the culmination or the end product is determined by your prakriti, or which is the involvement there.
Okay, so the thing is what I just want to brief it out is that when you have acne, don't say acne. You should show to yourself to the doctor to make out which doshas are involved in your acne to get the perfect treatment. Just don't go with the acne and just get your cosmetic, bring your cosmetic. Always consult either the doctor or any specialized person to before deciding your cosmetic. Isn't it, Dr. Amla?
Correct. Because many a times, you know, whatever you apply on the skin is not a therapeutic thing. It will give you a temporary result. Only when you treat it from inside can you make sure that this is going to last. The result is going to last for a longer period.
Okay. So you can just tell me the brief Vata Pitta Kapha intake, which they should not take. What they should take, we'll not talk about. What the person should know, what they should not take as a Vata Pitta Kapha to avoid the skin degeneration, or you can skin conditions.
See,
right.
Ideally, a Vata Prakriti person, they should avoid anything which increase Vata. So typically we say that grows below the ground, potato. Down in Kerala, you have tapioca. See, even watermelon, which is more of, see, anything after you eat, if you have a bloating, excessive bloating, it increases the vata in your body. This is just to put it very, very broadly. If there are no doctors in the group, it's for them to understand. Anything that increases a bloating can be increasing the vata. So you have to take account of that and just reduce them. Okay, for Pitta Prakriti person, you should avoid on excessive sour, salt and spicy things. Okay, salt and spicy things has to be avoided. When we say avoided, it's not like completely stop. Instead of using chilies, you can use pepper. Instead of using your normal iodized salt, you can use Himalayan pink salt. So there is always an option. Just control them. And Kapha Prakriti people, any high calorie diet, okay, in the sense, you know, anything which is related to high calorie can be correlated to your Kapha, like which excessive of sugar, okay, you have a lot of ghee, etc. Anything on that line has to be avoided. So you have to take things which is easily digestible, which is very light, that is what, easily digestible, and maybe include a little bit of spicy things, okay, that will improve their metabolism. So this will be the things that they have to be very careful in eating and not eating.
Right. So hope everyone must have understood. If you still have any question, please write it down in the comment box. We'll take it at the last. Now we, after skin, we'll come directly to the hair type. So first, we just take it as a Vata, Pitta, Kapha hair difference. How we can make out that what kind of hair I'm having. That way.
Okay, so ideally this will be a bit risky now or tricky, because most of us have had a hair treatment. So when we do a hair treatment, it is very difficult to understand. But see, some people, I'll tell you, especially in women, when we tie our hair, if it is very little, okay, you just have a very small bush at this that is always very dry and looks as if, you know, you have got a small crown over this. Small hairs coming up, it's not very healthy. It usually will be related to a Vata Prakriti person. Okay, so Pitta Prakriti people will have a long hair it will be like the normal things. It will not be too like excessively long or excessively thick or shiny, but it will not be too dry also. It will be a medium range. The Kapha Prakriti people are the ones, who have got very silky, long hair, which
Best.
is always very voluminous. So this will be,
Right.
in general, how you can identify your hair based on the Prakritis.
Okay, so now I think everyone could make out what kind of personality, what kind of hair they are having now. So now coming to health, hair care for their daily regime,
So that is
as
a
per
bit,
the Prakriti.
yeah, that's a bit controversial because, see, down Kerala, we take oil bath daily. And I think apart from
Right.
Kerala, no one does that. Okay, they do oiling once or twice a day. I mean, once or twice a week, and take
With
a
a
head
beak,
bath also
right?
once or twice a week. But here, what we do is we daily oil our hair and we take a daily head bath. So this we are used to it. But let me keep the Kerala people aside because we just form a very minority here. But generally, what you have to do is, if it's a Vata Prakriti person, yes, you can oil your hair regularly because they need a lot of moisturization. But I personally don't believe in oiling the hair and leaving it aside. Like, you oil your hair, leave it for 2 to 3 days. No, because you sweat a lot, there will be dirt accumulation, and it is not a hygiene. Okay, personal hygiene is not proper. So, in those conditions, I would prefer whenever you're oiling your hair, we can retain it. Vata Prakriti people can repeatedly increase the number of oiling, like maybe alternate days or maybe daily if possible. Pitta Prakriti people are okay. They can have alternate days oiling the hair and fine. It is okay. But Kapha Prakriti people, they can take head bath regularly. But they can keep the oiling once or twice a week. Because by nature, their scalp produces the sebum or the
More
oiliness.
sebum, right?
And one more thing
Okay.
people understand is, see, when you're oiling your hair once a week, you apply at least around 20 ml of oil on your head, starting from the scalp to the tip of your hair, which is not necessary. So what we daily recommend is around 3 ml. So 3 ml of oil is
Small
just a couple
quantity.
of drops, and that will be sufficient to massage the entire scalp. Oiling your hair is only required for once or twice a week. Scalp oiling is important. So the frequency
The
is
root
what
has to be
will
strong.
determine. Yes. And Kapha Prakriti has to be very careful. They should not retain the oil for a longer period. So I hardly tell them 10 to 20 minutes. Okay. And post that they have to wash it off because there are chances they will have some sinusitis, rhinitis, cold. So all the respiratory complaints might come to them. So that is the only restriction I
Oh,
put. Vata Prakriti can oil as many times as they want. Pitta Prakriti alternatively. Kapha Prakriti has to be doing it at least once or twice a week only.
okay, so is it something, Dr. Amla, like cool hair oil or hot hair oil, something like that? Like how if they go, for, like we have Binga Malki oil or we have different kinds of oil. So just at home, just give the broad spectrum, okay, how they can choose the oil for themselves.
See,
If they feel that it's
basically,
heaty,
yeah,
yeah.
see, the Pitta Prakriti people can use both. It's fine by them, okay, because they have the normal
Okay.
hair. But, when you look into Kapha Prakriti and Vata Prakriti, the Vata Prakriti people should have things which is slightly on a cooling side. Okay, so we say, see, when we are asking them, many people are preparing their own oils, like aloe vera, the small onions, all these things are cooling in nature. So those Shitavirya, what we specifically mentioned in Ayurveda, those can be incorporated. But if a person has a Kapha Prakriti, they are always having these rhinitis or respiratory complaints. So for them, it is always
Sure.
better to have a Ushnavirya or hot potency, like your Krishna Jeera, then your curry leaves. So those things are for hot potency. You have to use those while making the oil. Then what happens? Your kapha is under control, and then you will not have these respiratory complaints coming very often. But there is another option. You can always use the Rasnadi powder post head bath. So it's an
Bath,
application
right.
we all do here. So we
Uh,
apply it here and behind your ears.
just after bath. It's a normal practice in Kerala where they use
Yes.
Maharashtra, the choned hair
True.
at the crown after hair bath. So head bath, and to avoid post cold complications if the person, if the child or if the lady is having. So very nice, Dr. Amla. It's a very like concise way you have explained them. So okay, so now after knowing Vata Pitta Kapha, after knowing the normal daily regime, what is your take on using the integrative approach? Means using the modern instruments. This is and using the herbal products.
See, we have seen, being a cosmetologist, we do deal with PRPs, lasers, etc. So it is,
Yes.
see, these instruments or these techniques are just for a follicle stimulation. And what they, like the contemporary practice, they introduce their medicines. So we can also introduce our medicines, which is giving a very nice result. So what we do is, if you have a receding hairline, we give a laser stimulation for the follicle stimulation. Post that, we give them an oil massage, which oil that is
So
promoting the hair growth.
okay, so but why I've asked this question, that somewhere in Ayurveda also this Agni Karma, this Prachan
Everything is
Karma is
mentioned.
given.
Yes.
So we can say that we, this is all the new way of applying those techniques only in modern ways, isn't it?
Yes, slightly sophisticated, because see, PRP or micro needling, which is very, very commonly seen, they have a roller. They introduce pens. They cause micro injuries on the skin. Okay, and the
Yeah.
principle is that when there is an injury, there is a new collagen production for the healing, which will actually give up more and more growth proteins. Okay, growth factors, which is going to help you have a better skin or a better hair. In Ayurveda, there's a principle of prachana, wherein you rub some rough particles on the scalp, so that there is a pinpoint bleeding, and then you put in medicines that is actually promoting hair growth. So this is the same
Yeah.
principle. It's just that they have put it in a better model, and this old wine in a new bottle. The same thing.
Yes, because we cannot stay with the 5,000 years back. As the technology is improving, we also have to improve. So we can say this is a part of Ayurveda only. We cannot keep it aside, isn't it? So
Yes.
though it is integrative approach, but we can take it along. So why I'm asking this, all the Ayurveda doctors who are listening this, they should indulge, they should include all these techniques in their practice to get better result. Our products are very good. Our Ayurveda products are very result giving. But the thing is, using with the integrative approach, we can have a better results. Okay.
See, initially
Okay.
in my practice, when we just give a small lepa for a post-acne scarring, the result which I used to get was in a period of 3 to 4 months. But if I'm using it with
Okay.
a integrated approach with like micro needling or a mesotherapy, I'm getting a result in 1 month. So our medicines
True.
acts better when there is a different method of administration. So that you have to
Oh.
incorporate in your practice, because we have to change along with the changing world.
Right, true. So those who are listening, they can also go for the Ayurveda doctors who are working with cosmetology, and those who are using both things with so the side effect will be less and the result is faster, isn't it, doctor?
True.
Yeah. Okay. Now the one question is there. They were asking about what is your suggestion for the post acne mark?
See, post acne mark, it depends. If it's a Vata Prakriti person, usually you can see there is a blackening of the skin. Okay, you will have a very dark mark. And if it's a Pitta Prakriti person, usually it will rupture, it will go off. You will not have much of a mark on the skin left behind. Kapha Prakriti people, there will be pit forming, because their suppuration level will be huge, and you always have the post acne pitting seen in the Kapha Prakriti. So you have a lot of agents which is actually increasing the complexion or maintaining, evening out the complexion. Like if you want to go typically for Ayurveda, you can go for the Shastika Lepa, which is very good. But the thing is how you choose it. If you want to, if it is for a Kapha Prakriti person, I would suggest go with something like Triphala water or normal hot water. Make a paste and apply a pack. Shastika is it's a type of rice. Okay, it's called Nyavara. Okay, Malayalam, it's called Nyavara. It's a red variety of rice that is harvested in 60 days. And that actually is a very good management for the skin conditions. And if it is a dry skin, you can always make a combination of that, boil it in milk, and then apply a pack. And believe me, I have treated cases which was failed with chemical peels, lasers, with just a Shastika Lepa. to even out the pigmentation. So that there are very, very small, small things. You can have the Eladi packs. Eladi Churna packs are available in different pharmacies. You can use that. Or simply, if you don't have anything, the green gram powder from your home, just make them into a powder and then use it for a scrub or as a pack. Even that will help you out.
Dr. Ella, some people say that it will take a long time. We don't have that much time to hold and we wait for getting the result. Is it true that we get the result later with the Ayurveda?
Not much. See, skin is a condition where we get a very fast result. There are certain conditions, obviously, it will take some time. But skin, see, I come from a traditional family and basically we specialize in skin conditions. So what is not achieved by 6-7 years by the other contemporary sciences, we can find a result in the first 2-3 weeks. So at least 30 to 40% differences can be appreciated. Post that, it is delayed. That is not because Ayurveda medicine is delayed. See, the person who come to us have tried out so many things for so many years without any result. But in the first 3 weeks, if they find so much of a result from our medicines, they will go lax. They'll be like, okay, this is working. So even if I try to cheat sometimes, it will not happen. So if the patient is cooperative, we have had a very nice results, like, 7 to 8 years chronic history conditions of skin and hair, which is completely managed by 3 months if the patient is very cooperative. So
right, consistency in medicine applying.
Also,
so is it only oral intake?
No,
right.
Both. Intake.
So
both
intake
has to be taken.
Okay. Then there's another question about postnatal hair fall.
Okay, so it depends. See, usually once you are in the post-pregnancy time, for the first 6 months, I don't recommend anything because you are feeding, you will be undernourished most of the time. So there will be a calcium deficiency, there will be a vitamin deficiency. It is a part of your physiology. So anyone who's trying, the only thing is make sure you give a nice massage to your scalp and take a nice water bath. Okay, not hot water, normal bath. What you have to do is once the baby is weaned off from breastfeeding, you can take care of your nourishment, your nutrition, and then you have to apply some hair packs and all, which otherwise you will not have time in the first 6 months. So it is actually a physiological change because your body is going through a lot of undernourishment because you're feeding the baby, your diet, your lifestyle, everything is hampered. Because I think in the first 6 months you will be waking up every 2 hours to feed the baby. Your sleep is not proper. So this will be a part of it. You have to accept it. Don't get stressed because stress will again cause a hair fall. So just trust the people who you go to. They will give you a solution because post 6 months you can retrieve back the hair you have lost.
Sure. So that means that the thing is not to get apprehensive about hair fall. It is a part of life. Accept it. Second thing, go for the nutritional diet. Actually, our traditional diet is good enough. The good massage therapies like that is called after postnatal care. Sutika Paricharya, postnatal care in Ayurveda is actually for covering up all these disorders. Third thing is take a help of Ayurvedic doctor to overcome all these problems. Okay, so very nice session. I know you are very busy, Dr. Amla, so we'll keep it for a short, but we'll see you soon in another session soon. And what is your takeaway today after telling us all that people who are listening? What is your takeaway? In 1 or 2, 3 lines that they should take care of their skin and health hair.
See, we all like to be pampered. If someone gives you attention, we actually be more friendly to them. We respond to them. So your skin and hair is a miniature version of you. So treat your skin and hair how you want others to treat you. Pamper it so that, no matter whatever you do, they are standing strong with you. Okay. So it is a compulsory requirement. We don't understand the first signs of aging, though it comes in your late 30s. This aging process starts once you go from the Kafakala, that is your Yavana. You start your Balavastha to Yavanavastha. At the age of 18, your skin starts aging. But if you take a proper care of your skin, give it the enough attention that it requires, you can see wonders. Your skin will never let you down. You will go somewhere, they will not call you an auntie very soon. They will call you an sister or akka or chechi, whatever it is. So it's just that pamper your skin as you want to be pampered by yourself.
Very nice, very nice. That's a very nice takeaway for all of you. Please keep pampering your skin, keep pampering your hair, keep pampering yourself. All the ladies in this group, please keep pampering yourself and stay healthy, eat healthy. Thanks a lot, Dr. Amla, just to spare out few minutes in your busy schedule to come for my this live and share your knowledge. Thanks a lot. Thanks a ton.
Yeah, thanks Vibha for calling me out. It was nice to see so many people coming. It was very nice. Hoping to work with you again soon.
Sure, sure. We'll see. We'll soon keep a live on dermatology for the common. I was planning before. I was talking to you, and I was planning for the next session soon with you.
Sure,
Okay,
we
Dr.
always have
Amla.
that. Yeah.
Bye bye.